Hi everyone, my name is Aghajanian and I'll be discussing caffeine as an addictive substance. I also want to start off the presentation with an apology for any words I may mispronounce, as some of the words are rather difficult for me to say. So what does caffeine do? Caffeine inhibits receptors in the brain from the chemical adenosine. This chemical helps the nervous system shut down and allow people to fall asleep. Your brain keeps you awake when there is no adenosine. Additionally, caffeine raises your cortisol and adrenaline levels, which quicken your breathing and heart rate. So, some pharmacological considerations regarding caffeine is that it resembles those of other methylxanthines, which are chemical compounds such as those found in teas and chocolates. These effects include modest stimulation of the central nervous system, wakefulness, as well as the capacity to maintain intellectual engagement. Long-term caffeine exposure causes a significant buildup of paraxanthine, which are again chemical compounds, which most likely play a role in pharmacologic actions of caffeine. Thus, it would make sense to assume that paraxanthine would likewise aid in the establishment of a caffeine tolerance and the onset of withdrawal symptoms after prolonged caffeine exposure. So I want to discuss a little bit about the dosage and composition. Starting off with the composition, the plant alkaloid caffeine has a molecular weight of 194.19. Its chemical structure is C8H10N4O2. It is a bitter white powder in its absolute purest form. Caffeine and the other methylxanthines share structural similarities with purines as a as purines are heterocyclic aromatic organic compounds that consist of two rings. Now, dosages of caffeine does vary from person to person and because of body mass and so on, but the recommended daily intake of caffeine for healthy people is about 400 milligrams or approximately 4 to 5 cups of coffee. This recommendation comes from the FDA, and essentially they state that this quantity of coffee has no negative consequences linked to it. Sorry, I meant caffeine. But an estimated 10 to 14 grams of caffeine is a lethal acute oral dose for humans. Caffeine consumption up to 10 grams can have been known to induce convulsions and vomiting, with full recovery occurring in 6 hours. At doses of 15 grams, have extreme adverse effects uh, being seen in humans. These would begin as agitation, anxiety, restlessness, and progress to delirium, vomiting, convulsions, neuromuscular tremors, as well as increased breathing and tachycardia, or among other symptoms. So, caffeine can interact with drugs in sometimes very negative aspects. So, they can interact with antibiotics, bronchodilators, antipsychotics such as clozapine, some antidepressants, carbamazepine, which is when caffeine is could increase the risk of seizures with this medication. Caffeine can also interact with like estrogens, valproate, and some other medications. I have a couple examples written here. So, ephedrine is a drug which is found in decongestants. They increase the risk of hypertension, heart attack, stroke, and seizure when combined with caffeine. Theophylline, this drug, which opens up the airways in the bronchial tubes, frequently produces similar effects to those in coffee. Therefore, combining it with coffee may exacerbate its negative effects, like nausea and palpitations. It's essentially adding caffeine onto caffeine. And then Essentia, Echinacea. This is an herbal supplement that may raise blood caffeine levels and intensify the negative effects of caffeine. It is sometimes used to prevent colds and other illnesses. Some physiological aspects of caffeine is that caffeine has been shown by the European Food Safety Agency to improve endurance capacity, performance, and perceived exertion. Caffeine enhances performances on simple continuous response tasks and vigilant tasks. Again, these effects are frequently more noticeable when awareness is diminished. While there is evidence that advantages may still occur even when a person isn't impaired. However, the effects on short term, high intensity exercise may remain inconclusive. Uh, Caffeine effects on the sodium potassium adenosine triphosphate pump activity causes plasma potassium concentrations to drop. It is also has an impact on the process of depolarization and repolarization that occurs during exercise, which may have an impact on fine motor coordination. Caffeine has mostly stimulatory effects on the heart, which are followed by an increase in coronary blood flow. It is believed to be phosphodiesterase inhibitions rather than an action on adenosine receptors. It is a mechanism mediating these effects. Caffeine antiasthmatic effects may be explained by its ability to relax a smooth muscle and dilate the bronchi. However, it is still unclear how phosphodiesterase and adenosine receptors relate to one another in terms of the mechanisms behind caffeine's antiasthmatic effects. It also appears that caffeine acts through adenosine receptors to cause diuresis, increased blood flow, and renin production in the kidney. The behavior effects of caffeine is easily observed as neurochemically specific neurons and appears to be mediated by those phosphodiesterase actions and adenosine receptors. It is believed that caffeine stimulates dopamine, norepinephrine, serotonin, acetylcholine, choline, glutamate, and GABA neurons by obstructing adenosines actions, which normally suppresses neural functions. Certain stimulatory effects could potentially be explained through xanthine's suppression of phosphodiesterase. So, kind of talking about the frequencies or patterns of use, caffeine use is not recommended for young children, even though it may be acceptable for adults. It is important to warn adolescents and young adults about consuming too much coffee and combining it with other substances. As we mentioned earlier, some medications don't work well with caffeine as well as alcohol. A little fact is that women who are nursing a baby, attempting to get pregnant, or both should discuss with their doctors about keeping their daily caffeine intake to less than 200 milligrams, as excess coffee can lead to miscarriage and sometimes fertility issues. Individuals who usually don't intake caffeine on a more regular basis will likely be more sensitive to it, and caffeine is frequently ingested to boost alertness, as evident by patterns of consumption throughout the day. And I would just like to add that with the with the societies we live in and the environment we live in, even though it is recommended that children and young adults shouldn't intake so much caffeine, I would say just from personal experience and from what I've witnessed is that not that's not what's being followed. A lot of kids and a lot of young adults will even rely on caffeine. I myself have relied on caffeine for all-nighters, and I think it's because of the environments we live in and the responsibilities that young adults might have and the stressors that we have so much to do and so much to get done, and we rely on coffee as coffee or as caffeine as that pick me up. And so many people use that in order to like stay up and work on their presentations, work on their projects, and they might feel energized in that moment or in the few hours, but that lack of sleep will eventually catch up with them. And I just wanted to say how Even though, again, that caffeine isn't recommended for young children, it doesn't stop the young children from ingesting really high amounts of caffeine. I've seen middle schoolers drink at least two monsters in a day, which again is not healthy and absolutely not recommended. But that is the society and the environments we currently live in right now. So I know I've been focusing a lot on coffee as the main method of administration of caffeine, but caffeine comes in other than coffee, teas, chocolates, there's caffeinated gums, jelly beans, waffles, syrups, marshmallows. There's a lot of snacks that have like a lot of caffeine. Uh, Something I actually learned while doing research is that decaffeinated colas and like soft drinks actually don't contain any caffeine as they state, but decaffeinated coffee is not caffeine free, at least not completely. People also rely on caffeine supplements in order to get that boost of energy. Some people take pre workout. I myself take pre workout, which is, for those who don't know, is essentially a powder of that a powdered jar that has a little scoop, and it's essentially flavored caffeine that people will take before their workouts. There's multitude ways of actually ingesting it. Some people will put in a small amount of water and just take it all at once as that quick shot of caffeine, so that the caffeine energy boost is faster, but might I say the crash is harder. Some people take it slowly throughout their workout, and some people will just dry scoop it, um, because they say that it might essentially the caffeine hits them faster. There's also energy drinks, and these have varying amounts of caffeine. A lot of us have had at least a Monster or a Red Bull once in our lives, and or a 5 Hour Energy is just a couple of examples of uh, caffeine. But if you notice, a lot of these are essentially liquids that we would drink, are like the main methods for having or intaking caffeine. So the absorption process and rates. In humans, caffeine is absorbed quickly and fully after 45 minutes of consumption. Caffeine is quickly absorbed in the gastrointestinal tract and dispersed throughout the body's fluids when it is eaten in liquids, most frequently coffee, tea, and soft drinks. Chewing gum containing caffeine or using other preparations that facilitate absorption through the oral mucosa can result in more fast absorptions. Caffeine has an average half life of 5 hours in the plasma of healthy people. Caffeine's total plasma clearance rate is predicted to be 0.078 liters per hour per kilogram. This is elimination but its elimination half-life may vary from 1.5 to 9.5 hours, both intrinsic individual variations and range of physiological and environmental factors that affect caffeine metabolism, such as pregnancy, obesity, the usage of oral contraceptives, smoking, altitude, and so on, are responsible for large variations in the plasma's mean half-life of caffeine. So, discussing kind of how the body goes about distributing and metabolizing and excreting caffeine through our systems. So, the body distributes volumes which are about zero point 0.7 liters per kilogram, that indicate that the substances are hydrophilic and readily permeate the intracellular tissue water. Mm, Caffeine, however, is also sufficiently lipophilic to permeate the blood-brain barrier with ease and pass through all cellular membranes. A dose of 4 milligrams per kilogram, or about 2 to 3 cups of coffee in a study of adult men, resulted in about a 2.5 to 4.5 hour of half-life for caffeine. But this is completely independent from the individual's age. Now, caffeine, it is broken down in the liver and into derivatives of uracil, dimethylines, uric acid, and D and trimethylleilantonin. Sorry about that. A little bit, there is a little bit of it's a little hard sometimes. The main metabolic pathway in humans is 3-ethyl demethylation to paraxanthine. About 75 to 80% of the metabolism of caffeine occurs in the initial metabolic stage, which involves a cytochrome. The liver is where caffeine is primarily metabolized. It can stay in the blood anywhere again between 1.5 to 9.5 hours, depending on a number of variables. While oral contraceptives and pregnancy can decrease the breakdown of caffeine, smoking accelerates it. Caffeine can stay actually in the body for up to 15 hours during the third trimester of pregnancy. So there's a little fun fact for any women. Now, excretion of caffeine is very much like the excretion of everything we intake into our body, but only a limited portion of caffeine is eliminated unaltered in the urine after it is filtered by the aglomeruli, sorry, glomeruli due to its easy reabsorption in the renal tubes. Now, some behavioral changes resulting from like neurological transmissions of caffeine. Now, according to a study, caffeine can cause noticeable alterations in a number of human behaviors, such as excessive alertness and restless nights, increased availability of dopamine receptors, 2 out of 3 in the left and right striatum was linked to this impact. Now, again, the body's reaction will vary to caffeine, the amount of caffeine. And the reason I say this is because it's obviously going to affect someone who caffeine is a specific amount of caffeine is obviously going to affect someone a lot differently who's maybe doesn't really intake caffeine versus someone who is addicted to it, who's taking it on a daily basis. They need a lot of caffeine in order to kind of be their normal selves. So these are just very few examples. For example, some body sensations that people get, especially from people who don't intake caffeine much, will get jittery, even itchy. I myself take a pre workout that's almost 400 milligrams, and if I take it all at once, within 5 to 10 minutes, my body is incredibly itchy, and it's just from uh, the amount of caffeine that is just running through my system within 5 to 10 minutes. And again, that is because it is a very high dosage of caffeine very quickly to a person who isn't normally taking that kind of caffeine on a day to day basis. Emotion wise, people become people can have a lot of anxiety due to because of the caffeine, because it accelerates your heart rate, accelerates kind of in a lot of ways your mind. Some people say they're running a mile a minute in their head. They can't even talk as fast as they think. So a lot of anxiety can come from just too much caffeine. Irritability, and this I would say is more so connected to people who are taking large dosages of caffeine on a day-to-day basis. Obviously, you we see the people who are like, don't talk to me when I haven't had my coffee yet in the morning. So those are people who need a lot of caffeine or need caffeine in order to be not even just sociable, but in order to function. And those are the people who are so addicted to it that there's a bit of the dependency on it in order to be able to kind of go about their daily lives. Then we have the cognition of it. So a lot of time there's attentiveness. Again, people talking a mile a minute, a lot of people are kind of more focused on the task at hand. But sometimes there's also, again, restlessness because they're having to take so much caffeine into their system that they might not be needing to. And again, it is usually suggested not to have caffeine past a certain time, usually past evening, like 5 o'clock. It's not suggested to have caffeine in order to actually get a full night's rest. And as I mentioned before, there is such a dependency with like young adults on caffeine that they take so much caffeine in order to be able to get that next project done, be able to get that essay done in time. That because they're taking in so much caffeine, yes, again, they might be fine in that moment. They might be attentive and they might be energetic and excited at that moment because of the caffeine. But that lack of sleep will eventually catch up to them, where instead of maybe needing that 8 hours of sleep that generally people will need, when they sleep next, it might actually end up being like a 15 hours sleep because now their body is trying to catch up the rest that it needs. And just a little bit of the psychological aspects. Caffeine's main effect are to again reduce exhaustion and improve mental functions. And overindulgence in caffeine results in caffeinism, a condition marked by agitation, excitation, restlessness, wandering speech and thought, and insomnia. There is no denying that many psychiatric diseases share symptoms with this. The brain elevated lactate levels may be the cause of the stimulation of anxiety in response to caffeine. It has been observed that polymorphism on the A2A receptor gene are correlated with varying anxiety levels following caffeine administration, which suggests that adenosine plays a role in mediating caffeine induced anxiety as well. Based on research, it appears that individuals suffering from also eating disorders like bulimia and anorexia frequently drink high amounts of caffeine containing beverages because they believe that it enhances the metabolic rate and reduces appetite. Caffeine stimulant effects on the heart may be harm to anorexics specifically, since they are already at a high risk of cardiac arrhythmia. Overcompensation of caffeine may also be linked to osteoporosis, which is common in anorexic patients. And again, uh, essentially high dosages of anything is going to be harmful to a person. So everything should be taken in moderation. I myself have limited my own caffeine intake because it was causing me a lot of anxiety. I am a person who already has anxiety, and I had made that correlation that the caffeine intake that I have is way too high for me, and I should not be taking this as it is actively progress making it worse for me to go about my daily life. And so I myself have limited my caffeine intake where I don't really take pre-workout anymore and I stick to decaf coffee. Again, there is still caffeine in decaffeinated coffee, but it is so limited compared to what we are drinking. And again, it's a lot some of these the caffeine intake and how much we drink is varying, and how caffeine affects us all varies among person to person because of our body mass, because of how much we generally drink, whether we are very sensitive to it or we are addicted to it and we take it. We need higher dosages to keep us normal. And sometimes I would even say culture actually plays a big part in our caffeine intake and how we're raised on it. I myself am an Armenian individual and I grew up drinking Armenian coffee. So if I drink American coffee, it really doesn't affect me that much versus when I'm drinking Armenian coffee or my grandmother's like Persian coffee, which have higher contents of caffeine in the beans and in the coffee itself. So all of these varying, uh, all of these variables can affect the person in the way that they are taking in the caffeine, in the way they metabolize it, in the way they process it, everything. And I just wanted to mention that. And that was the end of my presentation. I know it was a little long, but thank you so much for sticking here with me. I appreciate it, and I hope everyone has a good day. Goodbye.